we'll go ahead and turn things over to Jennifer and Michael to let them kick things off this afternoon. We appreciate very much them joining us.
Thank you, David, for having Michael and I. I'd like to start by sharing my screen if I could.
I think you should be able to do that.
Okay.
Down at the bottom. Yep.
Yeah, that's going.
Okay. Okay, so as David said, my name is Jennifer Stone. I'm with the West Tennessee Senior Medicare Patrol. And my colleague Michael Pierce is with the State Insurance Assistance Program, the SHIP 10 SHIP program. And I'd like to start by just giving a brief few sentences about Senior Medicare Patrol, and then I'll turn it over to Michael, and he can talk about Medicare and Medicaid services and the services that he provides. So SMP, Senior Medicare Patrol, exists since 1996 to prevent fraud, waste, fraud, errors, and abuse to our vulnerable senior population for their Medicare and Medicaid services. Unfortunately, fraud has risen, and to the tune of $60 billion a year. That's billion with a B. And so we used to have one person to do SMP in Tennessee, and now we have two. And that's largely because of the amount of fraud that's taken place. People are being defrauded in various ways, all kinds of ways. We can get more information out to anyone who would like to know about that. But Senior Medicare Patrol services are available free of charge to all of Tennessee, every county in Tennessee. We do mainly public education, and we report fraud. So it is a free service, and we sometimes struggle to get the information out. We go to senior centers, faith-based groups, civic organizations, Rotary clubs, anywhere that we're invited to give information out, we will come and speak and give information. So that's kind of a tidbit about Senior Medicare Patrol. And then Michael, I'll go ahead and turn it over to you.
Thank you, Jennifer, and thank you, David, for having us. And thank you for joining this very important topic. The State Health Insurance Assistance Program has been in existence since 1990. And what we primarily do is provide Medicare, and you join Medicare because you're age 65 or that you are disabled. Those are the two ways that you get into the Medicare system. And I know that all of the county mayors who are on and those who have a vested interest in our citizens being informed about their benefits when it comes to Medicare, because typically that's all the health insurance they have once they reach age 65 is their Medicare. So the State Health Insurance Assistance Program is a national program, and we offer one-on-one assistance. We do not sell anything. We are non-biased, and we want to make sure that our seniors and those of the low income and disabled are not spending one dime more than is absolutely necessary. So we ask that you help us disseminate this information so that we can get into the spaces that we can't normally get into because we're just so limited with staff. There's typically only 2 to 3 people that work in the State Health Insurance Assistance Program. And so in the Northwest Tennessee region, we have 9 counties. And so we 1,000 people. There's no way 3 of us can do it alone. So we solicit your assistance with making sure that you help us to make your constituents aware that we're here to help them, number one, to make sure that they have the right coverage so that they're not spending a dime more than necessary. To Jennifer's point, that they're not being exploited by fraud. And we do know that both are on the rise. Healthcare costs is on the rise, and so is fraud. And so that's why we're here today to share what we do from a state health insurance assistance program perspective. We also have Medicaid, and Medicaid and Medicare sometimes get confusing, and some people don't know which program that they're in. And I've often said, when you don't know, then you become the most vulnerable. And then there is a national program that 65 and older participate in. That's your Medicare Part A and your Medicare Part B and your prescription drug plan, Medicare Part D. Medicaid is a federal program that's administered by the state that primarily take care of the low income, have Medicaid as a supplement. So Medicare and Medicaid work together. You can have both. And that's called a dual enrollment. And you probably have also heard of TennCare. TennCare is Medicaid for Tennesseans. And there is a based on income as well as based on resources that would qualify someone to be on Medicaid. So we help the state with the applications for Medicaid as well as income. So if you're income restricted, yes, you can have the state come in and supplement a portion of your Medicaid. Everyone pays a premium for Medicare Part B. This year, that's $185. So if someone has an income of $1,000 with their Social Security, and we take 185 and put that towards the Medicare Part B, now we're actually asking them to live off of $800. So that's where the state comes in and supplement the Medicare Part B premium and make it affordable to them. So affordability is something that we definitely help our seniors with and those of low income to make it affordable so that they can qualify. And so we have two ways to qualify. It's the low income subsidies and the Medicare Savings Program. The low income subsidies is through the Social Security Administration, and it is an application that will help lower the cost of prescription drugs. Here's the part. Most of our seniors, low income, they don't know about these programs, and the only way that they're going to learn about these programs is through maybe going to a senior center. So we want to make sure that the mayors are connected with the senior centers so that this information is there, available, and then we can get into the senior centers so that we can help facilitate this information. Or they hear it by word of mouth. Someone else has it and they tell someone else about it. But when you tell a story, it kind of gets a little diluted. And then people start to become a little skeptical. So we want to make sure that they're going to a trusted source like Jennifer in the S&P or myself in the State Health Insurance Assistance Program. Everyone gets the Medicare and You Handbook. I'm holding it up and I hope that you can see it. Everyone gets it, but it typically becomes a prop at the table. They probably don't read it, some may, but then there's a lot of information in there where they can learn about the resources that are available. The Center for Medicare and Medicaid Services has put together this information, but everyone don't read it, and those that read it could be challenged to understand it. Well, if you look on the back of that same book, you'll find the Tennessee SHIP 1-800 phone number that directs them right to our Nashville office, and then their information gets relocated to a regional office where they will be connected with a SHIP counselor. And then we can then answer questions for them. We can make sure that they're in the right program, they're in the right plan, and if they need assistance, we can then do an application to help them. So I'll pause here for a moment just to see if we can check in with anyone to see if anyone has a question. You can unmute yourself and because there's so much more information that we can share, but I don't want to get too far into the presentation to not give you an opportunity to ask a question.
Right, if anybody's got one, feel free to jump in and ask or type it in the chat.
And David, if you can just monitor our chat and just let us know if anything's there, we'll be happy to address it.
All right, I will do that. Not seeing anyone unmute, so if you want to keep moving on along,
I will keep
I'll
moving.
monitor the chat. Yeah.
Yes, sir. I'll keep moving. So we have 9 AAADs in the state of Tennessee that goes from East Tennessee to West Tennessee. Each AAAD has a SHIP office or someone who can answer questions. So when that 800 number is dialed and that beneficiary comes online, the state captures the information and sends it back down to the 9 regions where there's a SHIP office. As Jennifer mentioned earlier, we would like to have more representation in our counties where we can get into the spaces so that we can talk about changes that are coming with Medicare because it changes every year. This year, we had a huge change in the $2,000 cap on prescription drugs. I'm not sure if you've heard in the past years where they've had a, a donut hole or a coverage gap. That was something that was astronomical for some people when they learned that there was a coverage gap and they had to pay out of pocket probably 2 to 3 times more than they would normally have. So that changed in 2025. There is no longer a coverage gap, and the Medicare cap is at $2,000 on covered prescription drugs. Then we also had another change where we had 3 insurance companies to end their contract with Medicare for prescription drugs. So we had Clear Springs, they ended their contract. We had United of Mutual of Omaha ended their contract. And then we had Farm Bureau that ended their contract with the prescription drug plan Part D. So what does that mean when they end their contract? So their contract ended December the 31st. So that means if a beneficiary had one of those 3 for their prescription drug plan, that means that they no longer have drug coverage. And so could you imagine going to the pharmacy to pick up your medications if you paid very little for medications to them telling you now you no longer have prescription drug coverage? Well, because the 3 companies left the network, so to speak, it gave them what is known as a special enrollment period where they says, okay, now you have until December the 28th to choose another drug plan. Well, today is March 5th, 6th. So if they didn't choose one by the 28th of December, now they don't have prescription drug coverage and they can't get it until open enrollment, which is October 15th through December 7th. And that means for a full year now, they will not have drug coverage. Had they reached out to us back in September prior to open enrollment, we could have shared that information. Farm Bureau, Mutual of Omaha, Clear Springs, they're leaving the network. You're going to now have to choose a different drug company so that you'll have drug coverage. All it takes is a phone call, get on our calendar. We travel the 9 counties and we're in those spaces in Northwest, but this is replicated throughout the state of Tennessee, also throughout the country. SHIP is in all 50 states. There's someone to help navigate through Medicare. So that's just something about the uniqueness of SHIP and the SMP, and we get our funding from the Health and Human Services through this assisted living, the community living, Administration for Community Living, which is ACL. That's how we get our funding. So it's very important that you, as elected officials, know how SHIP is funded so that we can continue to operate in this capacity so that we can help those constituents in your counties. Now, open enrollment, as I've mentioned, is October 15th through December 7th for open enrollment for those who are on original Medicare. There are 2 types of Medicare. We have original Medicare and we have the Medicare Advantage Plan. The Medicare Advantage Plan open enrollment, we're currently in the open enrollment for a Medicare Advantage Plan. It started January 1 and it ends October 31st. March 31st. Thank you, Jennifer. March 31st. It ends March 31st. So after March 31st, you can no longer make any changes to your current Medicare Advantage plan. So if you're in an Advantage plan now and you want to change it, you have until March 31st to change it, and then that plan will go in effect on April 1st. So those are some things that we want to make sure that our public is aware of. Some people enroll in a plan and they stay with that plan forever. They never look back to see if the cost has changed, to see if it increased or if it decreased. Now, they will find out if they're in a plan, they'll start to get a bill and they says, I've never gotten a bill before. Well, something changed. And if you would have connected with a SHIP counselor, we could have made you privileged to that information so that you would have made a more informed decision. Some of the plans this year, we saw one that was a 0 monthly premium. Anyone who's not taking medication should be on the premium-free plan. It's not going to be automatic. So if you were in a plan and you're not taking medication and you stayed on your old plan, you're paying for something where you could get it for free. So don't you think it would be beneficial for everyone to know about Tennessee SHIP and make that call to Tennessee SHIP and get a review of their plan so that they can make sure that they're saving the money, because resources are precious. So I'm going to pass it back to Jennifer to see if she has any more that she wants to share about the Senior Medicare Patrol.
I would like to just say that every year, Senior Medicare Patrol has to report back to the Office of Inspector General, and that's kind of how we know how we're doing, so to speak. We know what kind of headway we're making. It's really hard to gauge the kind of progress that we're making with fraud prevention. So much of fraud goes unreported. So the $60 billion I mentioned earlier, only about 111 million is recovered. And that was those are 2023 numbers. So we don't have 24 yet, but that's a staggering difference in terms of what's being estimated to be lost and what's being recovered. So that number keeps going up. I'm sure all of you have either a loved one or someone that's on Medicare, or maybe yourself, that gets those phone calls just all the time about wanting to switch. And what I would say is that Medicare will never call you. Just like Social Security, just like the King of England, I mean, they're not going to call you. So if you're getting a phone call and someone says they're with Medicare, Medicare does everything by snail mail. So that's a sign that someone is just trying to get the information. The Medicare card, protect it like a credit card, because that number is valuable to people who are wanting to do harm to your Medicare bank. And ultimately, we all pay the price because taxpayer dollars pay for this. So this information is relevant to everyone, not just seniors, caregivers, people who just know elderly people. Everyone needs to know about this. And like I said, SMP is willing to come and do a presentation and teach people how to prevent identity theft among seniors, different ways to prevent fraud, because fraud has gone up so much. And people just don't know. They answer the phone and they just say yes. And sometimes isolation issues kind of bleed into that because people are lonely and they will talk on the phone to people who call them. Sometimes it's not the phone calls that cause the fraud. Sometimes it is, unfortunately, people we trust, our local pharmacists, our doctors. We had a case just last year where, and some of you may know this, there's been a press release about the pain clinic in Nashville and Clarksville areas. I think it was in other states too, but they were giving people injections, and if the patient didn't want the injection that was not needed, they would not give them their pain prescription. They would not refill their prescription for them. And that went on for 10 years. Employees and patients were complaining before it was handled. So the sooner we can get information turned into SMP and get it reported and investigation done, the sooner we can help people to overcome fraud that could be headed their way. And that's really all I've got about SMP. Anything else? So some other common things, fraud schemes are like genetic testing. They will call and offer genetic testing, remote patient monitoring, we all live in a day where people are more increasingly becoming tech savvy. And the great thing is, if the doctor prescribes some kind of remote device, then, I'm thinking of like a heart monitor or something. That's great. But if it connects to the internet, then you run the risk of it being intercepted and fraud happening. Outpatient mental health care. Of course, we've all seen like the card scams where they call and say, have you gotten your new Medicare card? I assure you, the little paper red, white, and blue Medicare card that everyone receives is all that you're getting. There's not a new laminated card coming, but that is a scheme. There's so many Medicare identity theft is so huge. And they use all these myriad of ways to obtain information from seniors in order to commit that fraud. So I would implore you to let your constituents know. We also come to libraries and hold presentations there. So we are out in the public, and if anyone would like to schedule something, we would be happy. Our information is on the screen here, and we would be happy to come and share information or connect you with the agency in your area and that SHIP program so that they can come and do it. And David, we thank you for the opportunity to share this important information, because Medicare and Medicaid are ever evolving, and the information really does need to get out to the public.
Thank you, Jennifer. I appreciate that. I'm glad you mentioned that you can connect them with other regions of the state. 'Cause I know
Yes.
from some of the folks I see on here, a lot of them are from other parts of the state, but this is good information, and I appreciate the work you all are doing. As I've gotten older, I get all those crazy phone calls about things asking if I'm on, and it's like, I'm not quite on Medicare yet. So, but I'm sure they wear our seniors out with the fraud attempts and the scams. So I'm checking again. I don't think we've got any questions appearing in the chat. So we've got a few minutes if anybody here wants to unmute and ask a question. But if not, I appreciate very much Michael and Jennifer joining us this afternoon. Like I said, we will, if you're here and wish some other folks from your county have been able to have an opportunity to see this, we are recording it and we'll make it available within the next few days after the meeting and have it up on our website. So certainly you can refer them to that. We'll be putting links in upcoming newsletters. So
Share our information and call us, email us. We'll be happy to direct you or answer the question ourselves.
Won't see any questions yet. So we will thank you all for joining us this afternoon. Thank you, Michael. Thank you, Jennifer. Appreciate you being with us.
Thank you.
Thank you.